1 in 3 women currently have BV.
BV. So between, like, if we had one more person in this room with us, odds are that one of the 3 of us would be experiencing BV.
Yes.
Okay. Hi everyone, and welcome to Prende Talks. I'm Megan from Prende Health, and we are so excited to have you here today. Prende Health is a digital health platform helping women with recurrent vaginitis, whether that be BV, bacterial vaginosis, or yeast infections, get the support that they deserve. And you can learn more about us here at our website, www.prendehealth.com. Now, I just recently moved here to New York City, and one of my favorite things to do when I'm not working is go grab a coffee or a lunch with friends. And I recently had a lunch lined up with my friend Mary until she sent me this text. Let me read it to you. So Mary said, "Meg, I'm so sorry, but can I take a rain check for lunch today? It's one of those days again. I'm burning down there. As though I'm not already in enough pain preparing for this quarter's board meeting. Sorry, girl." Now, the reason that Mary allowed me to share that text with you is that she's a recurrent vaginitis patient, much like you guys, and also like myself. And from one patient to another, we know how difficult it can be to have to constantly reschedule plans and also feel self-conscious about everything that's happening when you're experiencing symptoms. Now, Mary works at one of the prominent investment banks here in New York City, and so to say that she's stressed would be a complete understatement. And while I'm definitely upset that I didn't get to share a lunch with her, what's more important to me is making sure that she has the knowledge and the ability to manage her symptoms so that she doesn't have to cancel things in the future. And so actually quite shortly after I got that text from Mary, I got an email from one of our Prende subscribers asking how her work stress could be affecting her bacterial vaginosis. And so then it clicked for me. What we really need is a real conversation about what BV is, how stress impacts it, and most importantly, what we can do as patients to get a handle on it. And so I figured rather than being in the dark, I would bring in my go-to expert on all things vaginitis, Miss Kim Rubino, so that we can talk to her and better understand why is BV happening, how does it relate to our stress, and how can we stop it. Kim, we are so excited to have you here on Prende Talks. Thank you for making the time. Thank you for coming out. It's such a pleasure. Why don't we just go ahead and, before getting into everything about BV and stress and all the topics, just tell us a little bit about who you are, what it is that you do in women's health.
Sure. So going back, my career started as a registered nurse in women's health, was always my passion. I knew right away when I was in nursing school that I wanted to be in that labor room with the delivering moms, and I pursued it to the full extent. I worked as a floor nurse for about 8 years in the hospital, labor and delivery, while behind the scenes getting my master's as a women's health nurse practitioner from Drexel University. And I have been in practice in a private OB/GYN office for about 10 years.
Kim, you are operating within the healthcare system every day. You're experiencing the things that go well and the things that go wrong. And I know from my own patient perspective that there are just things sometimes that are just so frustrating about healthcare. And so I'm wondering, from your perspective as a provider, which patients don't really get to experience, what are those things that bug you the most and that you wish you could change?
So healthcare is, as we know, it's forever changing. It's something I wish at this point would be in a progression for improvement, but in my own practice, I'm one individual, and I feel, especially when it comes to women, that even though I'm one person in this large world, in my 4 walls, you can kind of let all the negativities of healthcare out and just concentrate on why a patient, why she's there on that particular moment, and nothing is too big and nothing is ever too small.
I mean, I imagine that some days you're seeing women in what will probably be the best day of their life, and then other days it is what is probably one of the worst days of their life. And so there's a lot of ups and downs.
Yes, and I'm so humbled every day because, whether it's hearing that fetal heart rate for the first time on the Doppler, or, explaining a woman about her vaginal pH and her discharge that she never knew before at age 48. It's mind blowing.
Yeah.
You know, and it makes a difference, you know, in women's life.
No,
I
it
hope.
certainly does. Yeah. And so, with all the patients that you see, how often are you seeing patients for vaginitis and specifically BV yeast infections?
Over 50%.
Over 50%. percent Wow. And so, if you're seeing over 50%, what is, out of all the appointments that are happening every year in the OBGYN office, how, like, what is the proportion of those that are going to be those patients with BV and yeast infections?
So a patient could be on my schedule for a potential urinary tract infection or just something much varied than what it actually is.
Yeah.
Because, so there is a kind of a missed percentage with that, because what people are actually coming in for and what they leave with having, or what I assess and diagnose and treat, could be totally different.
Could be totally different. No, that makes sense. That makes sense, especially because, you know, from my own patient experience,
Right.
you experience symptoms, you Google burning, itching, whatever it is, and pretty much, correct me if I'm wrong, pretty much everything is burning, itching, redness, and there's
And you
so
have
much
a yeast
crossover.
infection.
And you have a yeast infection, right? Yeah. I mean, this we know from research, right, that a lot of women think they have yeast infections, and over half
Totally.
of women who think they have yeast infections actually have something else.
Correct.
Right? Can you explain that a little bit? Why is there this misunderstanding?
It's, you know, it's a recurrent, rampant, regular presentation of my patients. I don't know where it stems from, but the reality is that if something is wrong in the vaginal vulvar area of a female, it's yeast. I
Yeah.
think it might be something that we learn from an early age, but I would say for like a problem type visit on my schedule, the first few words are usually, I think I have a yeast infection.
Yeah. And so a problem visit is when your patient comes in and she thinks something's wrong. So it's different from like you're coming in for your
Right.
annual.
A routine annual,
Okay,
yes.
gotcha. And so the reason that we're here today is to discuss what is BV. What is this condition that we see so many patients coming in with? So why don't we start off just you giving us your definition of what it is that BV is?
Sure. So just to backtrack a little, Megan, BV stands for bacterial vaginosis. It falls under the bigger umbrella of vaginitis.
Okay.
For some, there's different schools of thought.
Well,
But-
what are those different schools and why is there competing schools of thought to start with?
You know, because the research is still so ongoing.
Okay.
There is it's still such a chronic, misunderstood condition, which is, I think, the first thing that needs to be realized, the word chronic, because this isn't typically something that you can just go to your doctor and take antibiotics and it's gone forever. 1 in 3 women are currently have BV.
BV. So between, like, if we had one more person in this room with us, odds are that one of the 3 of us
Yes.
would be experiencing BV.
Yes.
Okay.
And
Wow.
she may or may not know it because the important facts about BV is that there's asymptomatic BV and then there's symptomatic.
Okay.
So when it's asymptomatic, it usually remains in the vaginosis realm. The osis is the key part.
osis. Okay. And what does that mean exactly, the osis?
It's just a presence of a pH abnormality.
Okay.
There's usually just, so to further go into that, BV is a imbalance of the pH of the vagina. The vaginal pH typically should be acidic, about 3.8 to 4.5.
Okay.
When the pH goes higher than 4.5, we're usually in the BV range. Usually one bacteria is present, and there may or may not be any other symptoms. Now, when that bacteria is present, and we're more basic at this point, the whole environment, the microbiome, the microbiota, there's so many different words we can call it, but it is its own functioning environment, the vagina. When, just like any community environment, when something alters or changes, there's the capacity, depending on other factors, for many things to change, and new bacteria can also enter.
Interesting. So let's go back 1 second, because you did also say that there's one bacteria. There's typically one bacteria.
Yes.
What are these bacteria that
Sure.
we're talking about?
So the most common bacteria that occurs in a BV state is Gardnerella.
Okay.
It is the most common. There's multiple others. So when Gardnerella is present, the patient may or may not, the woman may or may not be symptomatic. But when
Okay.
the pH starts to rise above 4.5, because again, stressing that the vaginal environment is solely pH dependent.
Okay.
It runs smoothly when the pH is within that subtle range, and it can go awry when it's high, below or above that. So when two or more bacteria are possibly introduced, because now we have an environment that is a little weaker, not operating properly due to multiple different reasons. And these are reasons that are common to women every day, which is, I think, the most fascinating, but not always in the best way to women, because they just can't believe that possibly their monthly menstrual period or being intimate with their husbands could cause such a dysfunction in the vaginal environment.
Yeah, I mean, it's shocking because those are the pieces of everyday life that we're engaging in, that our viewers are engaging in. Is I wake up and sometimes I have my period, and I use a certain soap, right? So like, what are these other factors? What can our viewers keep an eye on as they go throughout their days?
Sure. So the asymptomatic vaginosis, when there's more bacteria present, it can turn to vaginitis. And then factors such as fragrant soap, multiple sexual partners, douching, products in everyday drugstores.
Products, so like even the things that people are buying to make things better
Yes.
can be irritating.
Yes.
Wow.
And the majority of over-the-counter products are very damaging, especially in this realm.
No, yeah. And so we can talk about this more, but I want to go back just one more step
Sure.
to that definition of vaginitis, bacterial vaginosis. What exactly is happening in the vagina when someone is experiencing that symptomatic version of BV?
Sure. So I'm not sure if you've ever heard of a very important bacteria called lactobacillus.
Yep.
Yeah, good.
Yep.
Yes, it is more of a buzzword these days, which I'm appreciative of.
Okay.
My patients seem to know more about it, take it, use it. So lactobacillus is the healthy bacteria that is basically the functioning party of the vagina.
Gotcha.
So it is a hydrogen peroxide producing bacteria.
And what does that mean? Why would we want hydrogen peroxide? Sounds like something I wouldn't want in the
Right.
vagina, actually.
Touche. So it's a key bacteria because it keeps the vagina at that very intricate pH of 3.8
Gotcha.
to 4.5.
So it's our stabilizer. It's our pH stabilizer.
Exactly.
Okay.
So when lactobacillus is decreased, which, I mean, there is a laundry list of things that can do this,
Right.
but it's happening also on a cyclic basis. Our body is constantly, the vagina is constantly in a cycle and tending to things that we don't even know about, ups and downs and balance. So it's all about that balance. The lactobacillus is like the mediator,
Okay.
but when that decreases, there's a potential for other bacterias to enter,
Yeah.
take hold, and then we have an imbalance.
Gotcha. Or even like grow out of control, right? Because like you just said,
Sure.
Gardnerella, if I'm pronouncing that correctly, is always there. For some patients, it's there and they're asymptomatic, and then
Right.
all of a sudden it can just grow out of control, and then
Yes.
those patients are symptomatic
Yes.
and they're having that burning and itching.
Right. And it's almost as if, I think with many things in the body, and that's why the immune system is just such an amazing bodily system function, because everything in the external world is almost waiting for our body to have its
Yeah.
time, even if it's not good for us, but our immune system is constantly trying to fix and balance. Balance is the key. So
Yeah.
lactobacillus, when that gets decreased, and Gardnerella, and potentially Proteus or Mirabella, there's so many other ones, when they start to rise up, that's when we have a situation where bacterial vaginosis can also be vaginitis. So that's usually when the asymptomatic woman turns to a symptomatic woman.
Wow. Okay. And how quickly does that change happen?
To be honest, Megan, an hour.
Wow. Okay.
Yes, it could be just one use of an over-the-counter product that is unfortunately filled with dyes and fillers and fragrance. If we're already teetering on that side of maybe a pH of 4.4, that's probably just enough.
Just enough. Wow. So just the most minuscule of actions
Yes.
can just absolutely derail, I mean, not
Yes.
only the vaginal pH, but the date that someone is supposed to have 2 days from now, the vacation that they're about to go on,
Exactly.
the rest of, their
Yes.
life for the next week or so until they get treatment, can get in to see their doctor, all of
Right.
it. And so one of the stories that I really feel is important to bring up throughout this episode is that of my friend Mary, who lives a super high stress lifestyle. There's not much that she can do about it, but wants to do something about it because we know that stress can impact vaginal health.
Right.
So I'm wondering, right off the bat, what are the practical things that someone can do to mitigate and reduce the effects of stress on on their vaginal health?
So when it comes to individual stress in every different person, when you're looking at it, of course it is subjective, because what might be stressful to you is different what is stressful for me and the next person.
Yeah.
There's a lot of different factors, and the coping measurability, and also our underlying health. That has a lot to do with it,
Yeah.
especially on the mental side.
So things like when you say underlying health, like if I'm a patient who has diabetes
Right.
as well, or I'm a patient who, I don't know, explain that a little
So
further.
are you a person with stress, who deals with your stress? Do you go for a 30-minute jog when you're feeling,
Yeah.
it build and build, or are you going to go outside and smoke 5 cigarettes?
Well, it is, it's hard when the stress is inevitable to not feel so overwhelmed.
So when someone is stressed, it might be a recurrent stress to that person. So with time, the best thing or learned behavior is to identify what is triggering that, and ultimately altering the way that you handle it the next time.
So it's vaginitis then is not just vaginal health, it's mental health and it's emotional health and it's
Right.
finding that support. And so for someone like Mary, we've talked about action plans, like what is something that could be on her action plan potentially for her to do to be better?
So I think with Mary, it seems, she has this recurrent issue.
Yeah.
And first of all, realizing that she's not unique in that. There's a whole population of women that are going through, battling, frustrated with,
Yeah.
trying to cope with the same things. And it's just one more thing in the daily hustle of life that a female has to deal with. But again, understanding it being educated on it, having the support system to get through that, really, inevitably, that's getting through all stressors in life, right? Not just our vaginal.
For Mary, it seems like it's a case where we're stressing about when the next infection is going to come. And so it's a chicken or the egg situation. Is the stress causing the vaginitis, or is vaginitis being caused by stress? Like what's happening there? But I mean, like you said, there's a lot of ways to manage things. And I think that in patients' heads, all these different things that they can do kind of gets jumbled around. You know, do I take this probiotic? How often do I take this probiotic? If I'm doing stress, do I have to do mindfulness every day? Like how do you consolidate that information into a regimen that Mary knows is going to work for her and knows that she can follow too?
Right, and that regimen can be identified and followed. However, there has to be a mentality behind that regimen that it can change next month. Because as females, our bodies hormonally are constantly changing. So you also have to be able to adjust and adapt and not foresee a recurrence of symptoms as a failure.
Okay, gotcha. Yeah, because I mean, that's how we see a lot of things in life, right? When something goes wrong,
of course,
we failed. So then how do you manage, like, everything is always out of your control then, is it not?
Yes, it is. But there's some aspect of upholding as much control as you can by not letting it get to the point where it's of physical nature.
So then the whole goal is to just keep symptoms away, which is not unlike other chronic and recurrent conditions that we have, right? Like, for example, you know, hypertension. You know, the goal is not to just cure the way that your heart pumps, it's to make sure that we're keeping high blood pressure at bay. So then my question is, for Mary, where's a good place for her to start, you know? How does she know where to start her journey so that way afterwards she can be adaptable?
I will always promote, you know, consulting your primary physician or your OBGYN on this matter, because there are times when you need actual medication.
Yeah.
You can do all that you can to know and adjust and prevent with your daily habits, hygiene, practices. But sometimes when you're stuck in the middle of normal vaginal health and complete BV, it's going to try to sway either way. The bad's going to try to lead you out to that side, and your normal immune system will try to lead you back. But sometimes you do need actual, you know, medical care or medication.
Okay, so one of the things that I know that people are watching are wondering is discharge, because it's gross, it's icky, it gets in the way of a lot of things.
Yes.
Why, when we have BV, is there more discharge? Why is it smelly? Like, can you explain that for our users?
You know, it's something I often make humor about, but I find a huge capacity of my daily career is vaginal discharge.
Yeah.
And as disgusting as you mentioned, gross, uncomfortable as it may seem or be, vaginal discharge is necessary and a daily normal thing for every woman.
Right.
How it is occurring can vary greatly, and again, that all depends on the makeup of the vaginal environment.
I've experienced it myself for years and years and years, and all the symptoms, all the going to the doctor, all the treatments, the antibiotics, all of it, and it's so frustrating. And so I know that discharge just gets in the way, and it makes you feel so self-conscious, right? Like, do your patients often come in just feeling like not themselves, like they don't know what to do?
Yes, the burning, the odor.
Yeah, the odor.
You know, suddenly, why do I smell? Why does it smell? And that is part of the chemical process. It doesn't mean that she is dirty, hasn't showered, none of the above. It is part of the bacterial vaginosis process when the imbalance is off.
Gotcha.
So just curious, when you mentioned you went to the doctor multiple times, what was said, or what was your experience? Any education
Yeah, well, I
to
mean,
you?
from just what I've experienced and just my own, like, personal, just trying to understand what was happening, a lot of it was just, we're going to give you antibiotics, schedule another visit to come back and actually talk about what's happening. I mean, I'm at university, there's not a lot of open appointments. I mean, I'm sure you're aware, I bet that, a lot of your patients have to wait a little bit before they can actually get into the office to see you, unless there just so happens to be an open appointment. So there wasn't really a lot of education happening. It was mostly just like, let's fix the problem at hand.
Right.
And then let's move on. And then we'll do everything else when the time comes. And then that time just never comes for a lot of patients to really learn what's happening.
Right. Would you say it was somewhat of a misconception of the take-home message from the appointment that I'm going to give you this antibiotic and you're going to treat it and it's going to be gone? And
yeah. Well, I mean, like, I lost trust in that though, because it would work in the short term, and then just wait a couple months, just wait for one more thing, and you're not going to know what it is, but it's certainly going to come at a time that's incredibly inconvenient. And it's just going to be, it's just going to come back, and that discharge will be back, or the itching will be back, or just something very uncomfortable.
Right.
And something that you don't want to talk about is going to come back.
The statistics are staggering with the recurrence rates of BV, because again, how we started, the chronic underlying behavior of BV. I don't know, you might be more up to date with the most current statistics with that, but the recurrence rates are within like 3 months, I think over 50% recur.
Yeah. I mean, I was just reading a study again, because this is something that I just love to be as up to date on as possible. But within 3 to 6 months, between 30 and 60% of patients are going to see that infection come back. So if you're watching this and you're someone who, like me, has thought like, you've got to be kidding, another time I'm going to go to the doctor.
Right.
There's actually a lot of women that are thinking that and feeling that and trying to get back into the doctor. And I mean, from your perspective, when you're treating these patients, I'm sure you see those women who come back time and time again.
They do.
How does what you do for them change over the story of their patient journey?
Sure. So obviously through the years, I've learned that this is an education-based condition. So I assure at that first visit that I am teaching, educating from the start.
Okay.
Now there is somewhat of a barrier there from a health standpoint, because they're uncomfortable, they're irritated, they have an abnormal vaginal discharge, and they just want it gone.
Yeah.
But then there is that recurrent visit, because I would say it is a 3 to 6 month, I call it, you're in a rut. That's what I say to my women. I said,
quite a rut, isn't
yes,
it?
look at this as a little rut, and we're in it, and going forward, we're just going to be prophylactic about it.
And so prophylactic, so like preventative, like focusing on stopping it from the start.
Yes,
okay.
Understanding what BV is, tracking symptoms, that is huge. I have, nowadays with cell phones, a lot of women are tracking their cycles, their menstrual cycles, if they're of that age. So there's a lot of different other capacities in applications such as that.
Yeah.
So you can track, actions. Okay, I worked out. I have this symptom. Oh, I had intercourse last night. Now I have this symptom. Oh, I had my period. And over time, which doesn't usually take a long time, Megan, we are able, and I hope that I help my patients with that, we can identify what are that woman's individual triggers, and then we can be more preventative. Unfortunately, in the world of healthcare today, I feel like we are
it's not healthcare, it's sick care. We
reactive.
care for people when they're sick. Yeah.
Yes, and that's very unfortunate, because proactive healthcare is how the world would be a better place, but reactive healthcare, and this is due to all the insurance, logistics, and denials, and the list goes on. But stress, so when we're stressed, we know we're stressed and everything's exacerbated. And I think there's a tendency, especially for women, to overload their bodies more. You know, they'll take a overabundance of oral lactobacillus,
Yeah.
or they'll drink cranberry juice. And then we're at a state, we've almost done too much to try to fix, you know, one
Interesting.
happening in your life rather than trying to maintain constant. Because I think if we can maintain a constant with maybe not a whole bottle of lactobacillus in a week, you know, just
Yeah.
take it as you should gradually.
Yeah, and so these are like the probiotics that are just like in little capsules that you
Yes.
just drink, and so those mostly have lactobacillus
Yes.
inside of them. Gotcha.
So it's not so much reacting, because I think that furthers the stress response, because then we have a whole different problem, I feel,
Yeah.
than we started with, and that our body's already working on if we're underlying, have a healthy immune system, which the majority of
Yeah.
people naturally do. It's just that we're fed with unfortunate misinformation, and there's products to buy that are not
Yeah.
going to be beneficial.
So you try to right the wrong, and you know you buy the product, you buy the vaginal spray, you buy the wash, whatever it is that's in that beautiful pink aisle
Right.
at the store, and
Right.
that's just one more thing that your body has to take care
Totally.
of. So less is more essentially when it comes to
And
this
two
type of
wrongs
thing.
don't make a right.
Two wrongs don't make a right. Yep.
Yes.
So now what I'd really like to do, Kim, is dive into some of the technical, the sciencey things behind all of this, because for our viewers, one thing I really want them to be able to take away from this is that when they go into the doctor's office, they're a little more in tune with the words that are going on, or when they read the label on a probiotics package, they know why lactobacillus is there and they know the importance of it. So we have this diagram up here, which we'll display on the screen for all of our viewers, but we have this beautiful image of what a healthy vagina looks like, right? It looks like there's lactobacillus, it mentions vaginal epithelial cells, mentions vaginal pH. Why don't you just take us through, to start, what are the components within a healthy vagina, and like what are we striving for as far as vaginal pH, as far as what those lactobacilli are doing?
Sure. So, like many processes in our bodies, the vagina environment has its own, and it can be altered, and there can be, unfortunately, detrimental consequences because of it. So it's maintaining, again, the correct processes, but there's always changes and things that are going to happen that throw that process off.
Gotcha.
So let's talk about a process that the viewers might know well. So sore throat starts to happen, hurts to swallow. They might look in the back of their throat and see little white spots. Pretty soon they know to start feeling their neck. They might
Right.
look for lymph nodes, because it all equates with what? Possible strep throat.
Right.
So obviously the optimal is to not have any soreness in your throat, to not feel lymph nodes, and to not see white spots. The vaginal optimal environment has its own qualities and characteristics also.
Right.
It's actually very complex, and there is a lot of science behind it.
Okay, good.
And, understanding that science, I won't bore the viewers with, the real nitty gritty, but just for a basic understanding, because if you understand the science of it, then that's control, that's empowerment, right?
Yeah.
So here in this diagram, it shows the underlying vaginal, what we call the vaginal epithelium. The vaginal epithelium is a complex multi-layer system. I guess it could be classified under the dermatological category.
Gotcha. So like the vaginal epithelium, which is, the walls of the vagina that we probably don't think about all that much. It's like skin, right?
Like
Those
skin.
cells are made up of pretty much skin cells.
Yes, and if you see, we call it the epithelium. As our skin has different layers, you can see that there's different types of cells. Actually, the vaginal epithelium is so diverse some studies have shown that there's over 40 layers of the
Wow.
epithelial tissue within the
That's
vaginal walls.
a lot of cells. And would that be a good thing? Like, what do these cells do? Are they just there to be there? Are they protective? Are they disruptive?
They're actually, I mean, it's endless. It's multifunctional. So,
Yeah.
yes, they provide structure, they provide support, they provide lubrication, moisture. They are immersed with the hormonal cycles, our menstrual
Gotcha.
cycle, and how that happens. It's so diverse, and which is also diverse is very good, but diversity also can bring on a lot of potential for change, and sometimes that
Yes.
change
Yeah.
is not ideal.
That's really, really interesting. We have all these things going on. You mentioned mucus, and when I think mucus, I think sick. You know, I don't,
Sure.
nobody likes to see mucus. But one thing that you and I have talked about before is that discharge is actually good. So my first question is that mucus the same thing as discharge, or is it different? And is it actually a good thing?
That's a
to
great
have that?
question. So mucus, yes, mucus we know is something that actually lines the majority of our organ systems. It allows things to flow through, whether it's the gastrointestinal tract, whether it's the urinary tract. You know, in our mouth, mucus allows us to swallow.
Right.
You know, there's nothing worse than a dry mouth.
Yeah.
You know.
We underappreciative of mucus. Yeah.
Exactly. So mucus, yes, it is present in the vaginal environment also. And as I mentioned, it is a protectant of bad bacteria, but it also allows lubrication and overall health. Just like nothing worse than a dry mouth. Well, the irritants that could possibly occur because of loss of mucus, loss of inevitably discharge, can be very catastrophic to the vaginal environment, because
Yeah.
then we're going to lead to further irritation or painful, painful intercourse, or it's going to make having that period much more sensitive.
Yeah.
You know, if we are lacking the mucus, hence discharge. So there is something to be known across the board, is that vaginal discharge is good. Women will have it on a daily basis. Yes, it can vary in amounts in a given day for one person, but also from person to person. What the amount of vaginal discharge she has might not be the amount that the next person has.
Yeah, very interesting. Yeah, I mean, because one thing that I've also seen is the vagina is quote unquote self-cleaning. You know, we don't need to have these chemicals and all this stuff to clean, because that's what discharge is doing. What comes out with the discharge, right, is
Yes.
these vaginal cells that we're seeing that are actually old and dry. Like, it's time for those dead cells to go. It all comes out with the discharge that we tend to have, a hatred for and a
Right.
disgust for. But, discharge is good and it's
It's
healthy.
a secretory environment,
Secretory,
made
yeah.
of secretion. So as much as, it might not be ideal, one person might not like to visibly see it, but it's how we're maintaining health and draining things that should not be in there.
Yeah.
Because at the end, when it's all said and done, the vagina is the orifice that beholds the whole women's reproductive system. I mean, that's our fertility, that's our womb, that's everything. So it has a really important job to do.
Yeah, awesome. That's fantastic. Wow, very, very interesting. And then one thing that comes to mind is there's so much happening. It's such an intricate web, but what comes first? What is that kind of setting off the domino effect? Is it less lactobacilli? Is it the vaginal pH increasing? Is it the damage of a cell? Like,
I would
where
say
do we
the
start?
pH.
The pH.
I say the pH as a whole. If I had to choose one thing, again, what comes first, the chicken or the egg? But
Yeah.
I think if we had to do the chicken and the egg analogy with vaginal environment, it is the pH, because that is the first insult that makes everything else
Right.
happen.
Yeah, I mean, I think if I've learned anything, it's that in the vaginal health solar system, vaginal pH is the sun, and
Exactly.
everything is going to revolve, around that.
There
So-
are studies, Megan, that have shown vaginal pH on its own has very, very high specificity
Okay.
for basically diagnosing BV on its own. There's always
Yeah.
people, have different opinions, but that has always held true, that just testing the vaginal pH, whether someone does it at home, vaginally, of course you have to know why things are throwing it off.
Yeah.
What are those triggers that cause the pH to go high? Natural, external, what have you. But there is strong medical support that the vaginal pH is the base of all this.
Yeah. And so I definitely don't disagree with you that going to get a medical consult is of the utmost importance, because that's what we've seen in literature, which I can link those studies down below for our viewers who are interested in reading more. But antibiotics, antifungals, the medication, it works very well for these acute symptoms that, when you feel them, it'll get rid of them. But it's those long-term moments, that 3 months, 4 months, 5 months later, that it comes back and people are like, I don't think it worked. I don't think that worked for me. So I'm wondering, for myself, for Mary, for viewers who are watching, what is something that when they go home today, or when they go home from their doctor's appointment, they can do that they know is going to help them, at least give them a push in the right direction, so that they're just a little less likely to get that infection that's coming back
Of course.
5 months later?
So in reality, the job of the medical professional during that short interval of the appointment, yes, the patient, the woman herself, is seeking that, always would like to leave with some sort of treatment or
Right.
diagnosis, because that is reassurance. But when you spoke of what do you do for the rest of the time, that is the most important time.
Yeah, I would agree.
And I'm not saying it's easy, because my side of it is almost the easiest part. Because the hard is understanding it, doing the work in between the potential visits that might be deemed necessary. But it's almost every day, just being conscious and aware, like we should with all things in life, but also our vaginal health. Because
Yeah.
that is what is going to be the best treatment for yourself, is if you can, the in between the visits, however said interval, hopefully less often
Yeah.
than formerly for most women, but that's really the best treatment, Megan.
And so then what is it that we do every day? Is it, one of the reasons I think probiotics have gained so much popularity is that
Sure.
it's easy, it makes sense. I'm gonna take this every day, and while I don't believe that what we need for vaginitis is as easy as just, taking a pill every day, what is the low-hanging fruit that someone like Mary, who is, work at 9 a.m. to 9 p.m., she has, things to do. What's the low-hanging fruit for women to involve themselves with?
So it's actually a lot less complex than probably most lay people think. Oftentimes we're searching for some hidden truth, but it comes down to supplementation. Something simple as vitamin D.
Really?
Vitamin D, as much as the sunshine, milk, cheese, can give us our vitamin D, makes our bones strong. It's the extra skeletal benefits that vitamin D provides women that is most important.
Extraskeletal. So we're thinking like bones, like bone strength and
Yes.
things like that.
Yes.
Interesting. Okay.
So baseline, we know vitamin D keeps our bones strong,
right.
right? So that's how what we associate that vitamin with doing. As females, it is much more detailed than that, because being hormonal creatures, so our vitamin D within our system and our bones helps women with the aging process.
Okay.
So it not only helps lessening inflammation, lessens any sort of negative mood from a mental health standpoint. It improves our immune system, and all of those things, again, decrease inflammation.
Gotcha.
So when our vaginal walls, cells are less inflamed, they don't mature as quickly because the maturation process of the vagina also comes with age and makes for a drier environment, which we try to prevent.
Right.
And vitamin
Irritating, yeah.
Yeah, and vitamin D can help with all of that.
Wow. So that's incredible because I know vitamin D gained so much visibility during COVID, right? Everyone wanted to talk about the immune benefits of vitamin D. Very interesting. But there's a real tangible effect that vitamin D has for women in reproductive health and vaginal health beyond what most people have probably ever heard unless they went really, really deep into some of the science.
Yes, and it was always, yes, COVID brought it to the forefront, but it was always
It was always
it was
there.
always, the science was always there because
Yeah.
it's such a potent, pertinent immune booster for our bodies, which inevitably, as we spoke of, lessens inflammation, maintains pH, and all of these things is overall what funds vaginal health.
Yeah. Well, you know, it's interesting as you say this is I get the feeling that when we think about vaginitis, or at least when I think about vaginitis as a patient, I don't really think in terms of infection. I think in terms of that itching. That itching is back, or the stress or the worry, like, what is it this time? Is it BV this time? Do I have an STI that I have to go get treatment for? Like what is it? And so I almost entirely forget that it's an infection that, just like if I had a cough, just like any other infection, there's an immune system link. And I feel like that's consistently overlooked for more of a focus, for whatever reason, on go use this pink vaginal wash instead, or go use this wipe because the odor is bad. Like there's such a big focus on you should not have these symptoms. These symptoms are gross.
Right.
People forget those are symptoms of an infection because your body is not doing well.
Right. You just have to trust the process as best you can and know if, you know, going back to stress, if you have a stressful time coming up and you realize that, then maybe taking those extra precautions and being extra vigilant of the preventative measures that you know based on your triggers.
One of the things that we've somehow, you know, not covered yet is the diagnostic process. You know, what is it that you're looking for when a patient comes in and, you know, knows that she has some itching, maybe she thinks it's a yeast infection, maybe she doesn't know what it is at all. What are you looking for to diagnose BV?
Sure. So there's a fine line of, well, you have to listen to your patients too. You have to know the right questions to ask. Obviously, as a provider of, I could say, decent experience at this point, practicing that, I know those questions.
Yeah.
But I'm sure from the patient side, patients want to know what to ask me.
Exactly.
Is that something that you could relate to, Megan?
Yeah, for sure. I mean, because when you go into a doctor's office, there's a couple of things that at play, right? Like for me, there was always I don't know if I'm going to say something that sounds stupid. You know, is it stupid for me to go in and say, I have a lot of discharge? Is it going to be like something that my doctor doesn't want to hear, especially for something like vaginitis that's so personal? You know, there's always the question of what do I need to say? What's too much information? What's not enough?
Yes. And like many things in life, you get out of it what you put in. So when it comes to medicine, you know, you never want to go in, obviously, you know, you are technically on the more humble side. You know, depending on the way the practitioner practices, I think the most important thing is to just summarize your recent health, what you've been going through, things that maybe you've identified at home that you've been tracking, you know, again, with further education and, you know, community forums and talks here. And what we learned today, you know, hopefully that we can take home something.
Right.
And that something is that it's a process, there's science behind it. So you want to just bring that and maybe bring to your physician or provider's attention that I think my period, this could be a problem around my period.
Yeah. Gotcha. So don't be afraid to express, your thoughts and your questions and, maybe, guesses, I guess, that you have,
Yes.
because that does that help your provider just understand where to start, so that you're not coming in with a blank slate when you have a patient come in.
Totally. And just also understanding that the, the majority, probably all providers want your best health. So you just have to know that that is a overall maintained mentality. But you also have to go in, it's not always the best thing to go in, self-treating, I used every single product. We
Yeah.
discussed how damaging those products can be. So the doctor's visit shouldn't be the last ditch effort or
Right.
the last step.
Right.
It can be one of the first proactive steps for you to be able to confidently manage your vaginal health.
How proactive are doctor's visits really? Because, from my own patient experience, the doctor's visit came when I had just exhausted, like I just couldn't wait any longer. I just
Right.
had to go to the doctor. And then for me as well, those visits they tend to be short. It was, 10 minutes. And I know, from my own, studying and understanding that it's not the fault of the doctor, it's just the system of healthcare that we get 10-minute visits. So, how proactive is it really? And are there things that patients can do to kind of pull the proactive learnings out of an office visit that might really end up just being, getting an antibiotic and going home?
And that might be all it is, Megan, to be honest. We can try to change little things in life. Unfortunately, we can't change the whole healthcare system and its workings, and
Yeah.
it's so individual based on facility, community type of setting. So, with that being said, as a nurse practitioner myself, I feel very blessed in my practice that I do have the ability to educate. Nurses are educators when it comes to health. That's our lifelong base. So, in my practice, I feel like my patients are leaving. Yes, they might leave with a medication on a prescription, but they're leaving with knowledge, and
Right.
that's education I hope that I provided.
Thank you everyone for joining us on our first episode of Prende Talks with Ms. Kim Rubino. We are so excited to bring Prende Talks to you so that we can help destigmatize these topics within women's health, whether that be saying the word vagina, talking about what your discharge looks like, or even smells like. We're really here to try to give you a space so that you can hear these contents, learn about your vaginal health, and do so in what is a safe and an empowering environment. So if there's any content that you would like to see from us, just let us know in the comments below. And looking forward to seeing you in our next episode.